Just what is dystonia, and how is it related to Parkinson's disease and other motor symptoms? Is it a term for everything or just one specific thing? Let's explore that. The Parkinson Foundation produces a series of expert briefings periodically. This one is on motor symptoms and how to co-manage them. It also focuses on the question of symptom management. Is it Parkinson's disease? Is it aging? Or is it medication? This video is a quick summary of the original presentation, which lasted over 1 hour. It attempts to give you the key points. The key learning objectives of the whole presentation are to learn the 4 motor symptoms, strategies for managing them, and to learn how to co-manage with your therapist and doctor. Let's think of Parkinson's as a building we inhabit, or it inhabits our body if you prefer. Each of the 4 pillars represents a cardinal motor symptom: tremor, bradykinesia, rigidity, and postural instability. Here you can see Dr. Michael Okun, who is an internationally recognized neurologist focusing on treating Parkinson's disease. He, along with Lisa Warren, an occupational therapist, and Gretchen Rossworm, a person with Parkinson's and advocate, guide the presentation. Tremor is the first of the cardinal symptoms of Parkinson's disease. It is what people notice. Shakiness of hands, legs, and the chin. It typically affects one side of the body first. Majority of people experience tremor when at rest, and it may fluctuate throughout the day. Getting old is normal, but the shaking or tremors is not. It's not universal either, but it does help in diagnosis. Tremor can interfere with daily activities. How do you cope with tremors? Well, using a co-management model, here are 3 take-home tips from a neurologist, an occupational therapist, and a person with Parkinson's. Take a moment to just think about these tips. Pause the video if you need to take time to read these slides. Bradykinesia is essentially slowness of movement. It has nothing to do with anyone named Brady. Not only is there slowness, but its manifestations mean that daily tasks may take longer, you have difficulty initiating movements, and there's a decrease in facial expression or masking. Our stride may shorten so that walking any place takes longer. How do you cope? Take your meds on time, allow extra time to accomplish tasks, and improve your slowness and dexterity by shuffling and dealing cards, doing writing, tracing designs, etc. The next pillar or cardinal symptom of Parkinson's disease is rigidity. Another word for that might be dystonia. It's stiffness throughout the body. It can occur on one side or the other, and it certainly can cause pain and cramping. How then do you cope with that stiffness and cramping? The neurologist says take your meds on time every time. The occupational therapist says warm up and stretch. The person with Parkinson's says focus on gait and arm swing, try seated yoga, and frequently practice handwriting. The 4th major category of motor symptoms is postural instability, a fancy way of saying balance issues. It's the body's automatic correction that may no longer happen, and the greatest danger is that of falls. If you do fall, what then? Well, then you have to learn how to get up, and this is something you need to practice. So how do you cope with postural instability? First of all, don't depend solely on medications. but integrate consistent year-round physical therapy. Minimize your multitasking when you're walking. Focus on walking safely and take big and large steps. For a more in-depth exploration of motor symptoms, explore the full video. The link is in the YouTube description below.